Good afternoon, and thanks again for joining us today for our webinar session on consulting services for dentists to reach stage 1 meaningful use. Again, my name is Liz Ranchkowski. I'm a content specialist here at MIHI. And I'm joined today by my colleague, Thomas Bennett, who is a client services relationship manager. And we're going to be talking a little bit about meaningful use in general, and then specifically some considerations for the dental community in terms of reaching stage 1 meaningful use and how MIHI can help with our meaningful use support and services. Just a couple of housekeeping items before we begin. I wanted to let you know that you will be receiving a copy of the slide deck after today's presentation. So usually we send out a follow-up email to all participants within a week or two after the webinar session. And within that follow-up email, you will have a link to the slide deck. So you'll have this presentation for future reference. And also, I wanted to let you know that we will be taking questions at the end of the webinar session. However, you can feel free to enter your questions as they come up in your mind or as we're going through the presentation in the question box in the GoToWebinar function on the side of your screen. And what we'll do is we'll just hold all the questions till the end and go through them in the order they were received. So without further ado, we'll go ahead and begin the presentation. Our agenda for today is to talk a little bit about the Massachusetts eHealth Institute, or MIHI, and what we do here, a little about the EHR incentive payment program, an overview of the meaningful use stages, a little information on the recent CMS Notice of Proposed Rulemaking regarding stage 1 and stage 2 meaningful use. As I mentioned, some special considerations for dental providers, a little about MIHI's eHealth services and support, and then, of course, time for questions and answers. So at this time, I'm going to turn it over to my colleague, Thomas, to begin the presentation. Thomas?
Great. Thank you, Liz. Hi, everyone. My name is Thomas Bennett. I'm a client services relationship manager with the Mass eHealth Institute. And before we jump into the specific incentive programs and meaningful use, just going to touch on a quick graphic here in regards to MIHI and what we're about. As you can see here in this graphic, our vision is the global eHealth leader. Our connected communities enjoy better health at lower cost and serve as models of innovation and economic development. And this is across the Commonwealth. We are one division of the Massachusetts Technology Collaborative. Our mission is to engage the healthcare community. That is our charge. We help providers and practices across the state with sort of facilitating the development and adoption of health IT. At the bottom there are goals across the board. There are 4 there: adoption, 100% interoperable EHRs across the Commonwealth for all healthcare practices, supporting health reform. This is sort of the triple aim of better health, better care, lower costs, and consumer eHealth engagement. So engagement among providers and practices, as well as engagement with patients as well. Grow and promote innovation and the eHealth cluster. And there are some other goals that are tied in here that you'll see come up in future years. Okay, let's jump into the health IT landscape. As you probably feel, there's a lot that's going on with health IT here in the state. The complexity of the numerous initiatives and programs, reporting programs that are in place, meaningful use being one of them. There's both Medicare and Medicaid EHR incentive payment programs. And we'll talk a little bit more about meaningful use here in this presentation. There are also other programs such as the Physician Quality Reporting System, or known as PQRS, where you sort of reporting quality measures, ICD-10, and other CMS administrative initiatives that are out there. So there's a host of programs that are out there. It's, you know, we're here to help sort of keep track and for those that apply to you to help you facilitate you in terms of successfully completing those programs. Health IT requires change to both clinical and office workflows. We see this across the board. It's a huge adjustment for a number of practices, particularly smaller ones, and these changes that are required, of course, may extend beyond the resources that you have. So there are practices here in the state that just don't have the resources in place, so the infrastructure to sort of handle a lot of this change and that's required with all these programs. And so that's why MIHI is here to sort of either help assist with your infrastructure or resources that you do have, or maybe even serve as your infrastructure for working with these different initiatives and reporting programs. An important point is that most hospitals in the state have already achieved meaningful use of EHR systems. They've adopted and are meaningfully using those systems. So it's sort of inherent for you guys to and other practices across the state to get on board and use them as well. One point is that it's more likely that these hospitals who are meaningfully using EHR systems are going to refer their patients to providers and organizations that are also meaningful users. So it's sort of, this is where healthcare is and where it's going in the state. It's good when everyone can get on board and take advantage of some of the advancements in the sort of exchange of information and data that's available now. CMS incentive payments and penalties, so there are consequences for non-compliance, particularly with not meaningfully using EHR systems for any providers, and this may not apply to many dentists per se, but particularly with not demonstrating meaningful use on an annual basis. If you are billing Medicare at all, you will be penalized for not demonstrating that meaningful use. And then there are the other programs that we sort of touched on, for instance, PQRS. There are definitely penalties and payment adjustments that apply for non-compliance with those programs as well. Okay, MIHI's role, again, we mentioned how we sort of have a charge to assist providers across the Commonwealth with health IT and navigate that complex landscape. We have a broad range of services that we provide to providers. This is across the board. Again, I mentioned meaningful use, assistance with adoption of EHR systems, meaningful use programs, incentive payment programs, the other reporting programs as well. Capitalize on the shift toward performance-based reimbursement. So this is in that the changes that are taking place in the Commonwealth and with healthcare across the country. There's that movement from sort of the fee-based, fee-for-service model, and that movement towards the performance-based reimbursement model. Our role also is to help leverage health IT and achieve the triple aim. I mentioned that before. That triple aim is improving patient care, population health, and also reducing the cost of care. And then hopefully that adds to provider satisfaction. This graphic that you see here is just in terms of our resources and the services that we provide. At the very top sort of piece there, provide health IT guidance and resources. This is, again, the broad range of services that we provide, everything from assistance with adopting certified EHR technology, through help with supporting providers with the different meaningful use programs and other initiatives and reporting programs. And those services you can see on the moving around toward the right, supporting EHR adoption and meaningful use. Education as well, delivering different trainings, workshops, webinars such as these. We are constantly launching or giving programs or webinars to help educate the provider community on the different initiatives and the different services that we provide to help them with the programs that are out there. Again, this is one of many. And one thing you can do is go to the MIHI website, and the events page is where you'll be able to locate a calendar of events to see what things are upcoming, as well as be able to access resources from past workshops or webinars. For instance, getting maybe copies of the slide decks used in previous webinars, as well as being able to access the audio. Collaboration, fostering and facilitating stakeholder collaboration among the various providers and practices across the state, vendors for EHR technology, and we are, again, with that charge in terms of assisting with all of that across the for providers across the Commonwealth. And then funding. There are different programs in place where, for instance, some of the services that we provide towards meaningful use, those services are subsidized. And there are also grant programs in place, particularly, now there's a grant program in place with MeHI for behavioral health. So again, behavioral health, dentists, oral health, very important to overall health care, and we're sort of making a point to reach out and facilitate those two areas participating in the health IT landscape here in the state. As it may seem, at first glance that a lot of these programs don't particularly apply to those two specialties. Okay, let's move into the EHR incentive payment programs. Again, as I mentioned earlier, there are two. There's the Medicare as well as the Medicaid EHR incentive payment programs. This slide just sort of highlights some of the differences between the two programs. On the left, you have the Medicare EHR incentive payment program, which is managed by CMS. Medicaid, on the other hand, is a state-managed program here. The last year to begin participation and receive incentive payments with the Medicare program was last year. So that boat has sailed in terms of being able to participate and earn incentives. You can participate and still demonstrate meaningful use to avoid penalties. And doing that on an annual basis, that still applies for those that are billing Medicare or registered with the Medicare program, but the incentives and payments have stopped. For Medicaid, the last year to begin that program is next year, 2016. So you can still receive incentive payments for achieving the different various stages of the Medicaid program. And you can see full participation for the program would give providers up to $63,750 in incentive payments for successfully completing the program. Medicare payment reductions begin in 2015, so you'll see those penalties starting to hit those Medicare providers this year who are eligible for the incentive payment program but are not participating. So non-compliance, again, you would see payment adjustments or penalties to your Medicare reimbursements. There are no direct Medicaid payment reductions or penalties for providers who don't participate in the Medicaid program. But again, still, those Medicare penalties would still apply. So you could register for the Medicaid EHR incentive payment program. You wouldn't be penalized by Medicaid per se, but if you do happen to bill Medicare at all, any of those reimbursements that you're receiving from Medicare will be penalized for, again, not demonstrating meaningful use on a regular basis, on an annual basis. Okay, in the first year and all remaining years, providers must meet meaningful use objectives and measures. So that's, again, just speaking to that point that you are required to demonstrate meaningful use on an annual basis. And for the Medicare program, that is the first step, stage one, meaningful use, and we'll touch on that a little bit moving forward. But stage one, meaningful use is how you would start in that program. Medicaid, there's an option. You can either start at stage one, meaningful use, and going successfully meeting all the objectives and measures that go with that. But with Medicaid, there's also an option where your first year can be simply adopting, upgrading, or implementing a certified EHR system, and that would bring you success with that first year of the program. And then the next program year, that second program year, you would go into stage one, meaningful use, and having to meet all of those same objectives and measures that are required by the Medicare EHR incentive program. Okay, so the last year of program participation is 2016, as we mentioned. The last year of program participation for the Medicaid incentive payment program is 2021. Okay, a little more about the Medicare payment adjustments. These penalties or payment adjustments for failure to demonstrate meaningful use, as I mentioned, this is all set forth by the Health IT Act of 2009. Those penalties will take effect starting this year. People that are billing Medicare, you'll receive those letters from CMS stating that you are on the hook for those penalties, and they'll give you the reason why, whether it's again, failure to demonstrate meaningful use, or whether it's around those penalties are around non-compliance for other reporting programs. Again, 2014 was the last year that providers could initiate participation in the Medicare EHR incentive payment program and receive incentives. And again, there are no penalties for the Medicaid program specifically. Okay, let's jump into meaningful use. Meaningful use is at, of course, the core of both programs, Medicare and Medicaid incentive payment programs. Meaningful use is, again, a host of objectives and measures that are required by providers to meet those measures in order to successfully demonstrate meaningful use. CMS has set the standards for those providers to meet those objectives and measures. The HITECH Act that we talked about specifies three main components. It's use of certified EHR technology in a meaningful manner. An example of that is e-prescribing, use of the certified EHR technology to electronically exchange health information to improve the quality of care. And that's more about that interoperability of the technology, to being able to exchange information, share data amongst providers and practices across the state, regardless of the make or model of your EHR system. And then also the use of EHR technology to submit clinical quality measures and other measures as well. That's another part of those requirements of meaningful use that you'll see as well, that there are some clinical quality measures that are required, sort of touch on different sort of health priorities. The different stages of meaningful use. Currently there are 3 stages. The first, stage 1, is more about data capture and information sharing. This sort of sets the stage or sets the baseline for meaningful use, and being able to just capture data from your patients, for example, and then again, being able to share that information, whether it's summaries of care or transfers of care, etc. Stage 2 is more advanced clinical processes. There are some new proposed rulemaking in place right now by CMS that has not been finalized. That's an example. We'll see that happening this year in terms of any particular changes that might take place with some of the objectives and measures for meaningful use. Guidelines for stage 2, again, are built on stage 1, and sort of furthering your use of that technology. And then improved outcomes to be developed through future rulemaking. Again, we'll see some of that finalized this year as well, in terms of how providers are dealing with stage 2 as well as stage 3. And stage 3, again, is expected to be implemented in 2017. And that's just the forecast as of now. Okay, a little deeper into stage 1. Again, we're talking about the capturing of data, capturing of health information in a structured format, and that's important. A structured format is how the data and sharing information is possible, being able to exchange that data regardless of the make or model of your EHR system. That structured data is, again, being able to read data sent from another provider, as well as being able to capture that data and perform analyses. Establishing the functionalities of certified EHR technology that will allow for quality improvement and easy information exchange, communicating that information for care coordination purposes, again, in a structured format whenever feasible, implementing clinical decision support rules to facilitate disease and medication management. And these can be, examples of this are, identifying different factors around disease for patients, maybe triggers or alerts that let you know possibly maybe, oh, this person is being treated for this particular condition, you know, they shouldn't be prescribed this particular medication. So these are different decision support tools that are available within, or that you can implement within your technology to help coordinate and sort of provide better care for your patients. Using EHRs to engage your patients, their families, and reporting clinical quality measures and public health information. So along with being able to share the information and exchange data among the different providers and practices throughout the state, but also to engage your patients, to involve them, and so that they have sort of a stake in their own health care and the management of their own health care. Okay, let's move over to stage 2. Again, we're building on the baseline set by stage 1, expanding upon the criteria to encourage the use of health IT for the quality improvement of health care at the point of care and the exchange of that health information in that structured format that we talked about. And an example of that is the transmission of orders or e-prescribing, using computerized provider order entry. And that's you'll see that is one of the objectives for meaningful use. More rigorous health information exchange. You see that as well. Increased requirements for e-prescribing and incorporating lab results. Electronic transmission of patient care summaries across multiple settings. We mentioned that as well. Being able to provide care summaries. Maybe someone's being referred to another provider, being able to provide a care summary to that accepting provider. And then more patient-controlled data as well for stage 2. Stage 3, which again hasn't been totally set, and that's something that will come in the next year and a half or so. It's focused more so around improving quality, safety, and efficiency. Again, decision support for national high-priority conditions. Patient access to self-management tools. Again, how you're engaging your patients and taking that to another level in stage 3 for sort of being able to actively manage their health care. Access to comprehensive patient data through patient-centered HIEs, and then improving population health and improving health outcomes as part of that. You know, if you see those sort of terms coming up, improving the population health and outcomes, all part of the triple aim of health IT. And with that, we're going to talk a little bit about the notice of proposed rulemaking and those changes that may be coming around the bend. So I will pass it over to Liz to discuss that in a little more detail.
Thanks, Thomas. So as Thomas mentioned, we just want to give a quick overview of the CMS notice of proposed rulemaking as it relates to particularly stage 1 and stage 2 meaningful use and the proposed objectives for stage 3. So the CMS notice of proposed rulemaking regarding stage 3 was issued on March 30th, 2015. And then a couple of weeks later, CMS issued another NPRM regarding modifications to meaningful use for 2015 to 2017. And those modifications would relate specifically to stage 1 and stage 2 meaningful use to better align those objectives, reporting periods, and timelines with stage 3. So why is CMS proposing these changes? Good question. So basically the goals, as they've stated, are to, as I mentioned, better align with stage 3 proposed rule to achieve the overall goals of the program, synchronize the reporting period and objectives and measures to reduce provider burden and get everybody on the same page, and then third, to continue to support the advanced use of health IT to improve outcomes for patients. So the proposed changes would affect the following components of the Meaningful Use EHR incentive program: the participation timeline, the EHR reporting periods, the meaningful use objectives. There's no significant changes to the purpose of the objectives. So again, those goals that Thomas mentioned earlier about improving patient care, care coordination, and reducing costs, all those objectives and goals remain the same, but it's just a different route to get there. And additionally, no enhancements to your 2014 edition cert are required to participate if these proposed rules are in fact finalized. So as far as the timeline, in 2015, everyone would attest to what they're calling a modified version of Stage 2 with accommodations for Stage 1 providers. So what that means is that they would have one set of objectives, which they will call modified Stage 2. And if you were scheduled or planning to attest for Stage 1 this year, you would have special accommodations within those standard modified Stage 2 objectives. So in other words, you may have a lower percentage threshold to meet, or if there are 3 components to the measure, you may have to only meet 2 of the 3. So it would essentially be a bit easier to meet the objectives. But the objectives themselves, in terms of their title and the content, would be the same. In 2016, everyone would attest to a modified version of Stage 2. In 2017, everyone would attest to either the modified version of Stage 2 or the full version of Stage 3. And in 2018, everyone would be attesting to the full version of Stage 3. So the goal is really to get everyone on the same page and aligned by 2018. In terms of the changes to the reporting periods, in 2015, all providers would attest using an EHR reporting period of any continuous 90-day period within the calendar year. So if you were expecting to attest for a full 365 calendar year EHR reporting period this year, you'd be off the hook for that. It would just be a 90-day reporting period, which may come as a relief to a lot of people who weren't anticipating these changes. So if this is finalized and approved, everyone would attest with a 90-day EHR reporting period this year. In 2016, first-time participants would attest using any continuous 90-day reporting period, and returning participants will be required to attest to a full calendar year. In 2017, all providers will be required to attest using a full calendar year, with the exception of Medicaid participants attesting to ME for the first time, who would, again, be allowed to use that 90-day reporting period. So as Thomas mentioned earlier, if you participate in the Medicaid EHR incentive program, you do have the option to adopt, implement, or upgrade in your first year of participation and not move right into Stage 1 meaningful use. So for instance, if you initiated participation in the Medicaid EHR incentive program in 2016, you would potentially be able to attest for what we call AIU, or adopt, implement, upgrade, in 2016. So then your first time meeting Stage 1 meaningful use would be 2017, and if that's the case, you'd have a 90-day reporting period. But everybody else would have a full 365. So proposed changes for Stage 1 for eligible professionals would be to go from 13 core objectives and 5 of 9 menu objectives to a simple 10 objectives plan. Very similarly for Stage 2, we would go from 17 core objectives and 3 of 6 menu objectives to a simple 10 objective outline. So essentially, both Stage 1 and Stage 2 would align with one another and have the same 10 objectives. But as I mentioned, there would be accommodations for Stage 1. If you are planning to attest for Stage 1 this year, you'd have maybe some lower percentages to meet, or some different objectives, different measures within the objectives, to potentially meet. So just a quick list of the proposed objectives for both Stage 1 and Stage 2. As you can see, there are 10 of them there. Computerized provider order entry, or CPO, e-prescribing, clinical decision support, the patient portal, the security risk analysis, which is a really important component and won't be going anywhere regardless of whether or not these proposed changes are finalized in the form that they've been proposed. The patient-specific education resources, medication reconciliation, the summary of care, secure electronic messaging, and of course a public health reporting measure, which has several options within it. And as we move forward and we find out more about what's going on with Stage 1 and Stage 2 meaningful use, we wanted to speak a little bit about some special considerations for dental providers with regard to Stage 1. So with that, I'll turn it back over to Thomas to discuss those considerations. Thomas?
Okay, great, thanks. Okay, so special considerations for dental providers. I mean, that's why we're here for this webinar here. If you're looking at the objectives and measures for stage 1. And a lot of times you look at those and you would say, as a dental provider, that some of these don't apply to me. So how do I respond to this? So how can I successfully meet these objectives and measures? And there is a way, and we can help you with that. So again, these special considerations for these, for instance, stage 1, the core measures, there are exclusions that are available for providers such as dental providers that they can take advantage of. Looking at the first one here, we mentioned the CPO, or computerized provider order entry, and e-prescribing. This is one where, for a number of dentists, it doesn't apply, but again, there's an exclusion available where if you are writing fewer than 100 prescriptions during the EHR reporting period, you can claim that exclusion and again get credit for meeting that measure. Another one is recording vital signs. This is something that dentists don't typically do in terms of recording height and weight and blood pressure. So a dental provider can exclude all 3 of these if they have no relevance to your practice. You can exclude just height and weight if no relevance, or it can exclude just the BP or blood pressure if there's no relevance. So again, those exclusions are the same as meeting the measure. Patient electronic access. Again, access is defined as the patient has all the information needed to view, download, or transmit their health information via website with the username, login, etc. Any other instructions. Health information includes the patient name, provider's name and contact info, the problem list, procedures, meds list, medication allergies, those vital signs, etc. You can exclude if information beyond the patient name and provider's name and contact info is not ordered or created. Okay, so that's an important point there. So again, just moving through, and this is an example here where protecting electronic health information, this is one area where there is no exclusion. So this would be, as of now, this would be core measure number 13. Again, no exclusion will be a required measure, even if meaningful use is modified based on the notice of proposed rulemaking that Liz just spoke of. Providers must conduct a security risk analysis, as Liz mentioned also, that's not going away. That's something that you'll have to do annually, as well as a part of meaningful use, to conduct that assessment, implement any security updates as necessary, and correct any gaps or deficiencies that you identify as part of your risk management process. And again, that's something that we can help you with as well as one of the host of tools and resources that we have available to support providers with meaningful use. Again, and with that security risk analysis, it is very important, but it's also the primary area where providers fail audits as well. So very important in terms of completing it, as well as making sure that you're not only completing the assessment, but developing sort of a remediation plan for how you can address any deficiencies, and then having that supporting documentation, that backup around all of that to be able to provide in the case of an audit. Okay. So again, MIHI, we offer privacy and security tools that can help you complete your security risk analysis. We have a tool called Secure Connect that is very intuitive, easy to navigate, and easy in terms of being able to prepare a remediation plan beyond your initial assessment. Okay, currently the following menu measures, so we've kind of taken a look at the stage 1 core measures that have some exclusions available for dental providers. Now we're looking at the menu measures that offer some exclusions that may be applicable for dental providers. The first here is drug formulary checks. This can be, you can take an exclusion here, again, if fewer than 100 prescriptions are written during the EHR reporting period. The lab results, this can be an exclusion taken if no lab results in either positive, negative, or numeric format are made. Patient reminders. Dental providers can take an exclusion here if they're not seeing any patients 65 years and older or 5 years and younger, with their records maintained within their EHR system. Medication reconciliation. Again, another area where the provider can take an exclusion if they're not a recipient of a transfer of care. Summary of care. This can be an exclusion if no transfers or referrals are made during the EHR reporting period. Okay, and then here we have the immunization registry and syndromic surveillance menu measures. Exclusion can be taken here if there are no immunizations administered and or no reportable syndromic information is collected. Okay, so these are areas where you can see where these particular topics or objectives may not apply to the scope of your dental practice. And again, you can take these exclusions if they apply and get credit for meeting that measure towards successfully demonstrating meaningful use. Okay. Again, so dentists who achieve meaningful use gain advantages just like any other provider. Again, those incentive payments are on the table for dentists just as it is for any other type of provider. Again, within the Medicaid EHR incentive payment program, all the different stages, whether it's you're starting with AIU, just adopting, upgrading, or implementing a certified EHR certified EHR system, you can earn that incentive, that first incentive payment. And then again, completing stages 1, stage 2, etc., you will earn additional incentive payments for successfully completing those. And again, you can do those with our help, as well as understanding that you can take those exclusions that we just talked about. Avoid the Medicare reimbursement penalties. So for those dental providers who, it may not be their primary form of insurance used, but if you are billing Medicare at all, then those penalties, those payment adjustments will apply to you, and you'll see that hit come to your reimbursements. Keeping up with the advancements in health IT. Again, this is where we are with health IT, and this is where it's going. It's going to continue to probably evolve, as we're going to see here with some changes taking place with the new proposed rulemaking, and also seeing where all the hospitals are effectively, meaningfully using EHR technology, exchanging information, and we'll be looking for partners to exchange information with and make referrals to. Further integration of dentistry and healthcare. So oral health is an important part of overall health. So, among all the hosts of different providers and specialists, this is where, achieving meaningful use is another advantage for dental providers, that they're, further integrated in the overall healthcare community. Okay, so you've seen the considerations where it is, meaningful use is something that you can achieve. There are incentives on the table for you, with achieving meaningful use. And again, providing this information is just one way that we're here to help providers, but we also have, e-health services to support providers, and including dental providers, with achieving that meaningful use. And some of the ways that we do that, some of the services that we do provide include meaningful use gap analyses, where we can, see where you are with all of the objectives, core, menu, clinical quality measures, etc., that are included within meaningful use. We can take a look at your dashboards in your EHR, see where there might be gaps or where you're falling short, help you with those obstacles that you might be hitting, in terms of maybe even making adjustments or changes to your workflows or processes within your practices to, to be able to to fulfill those different objectives and meet those measures for meaningful use. We can help you with registration and attestation support. Particularly we have with Medicaid, we have a Medicaid operations team who are the experts with the application process and provider verification process in terms of registering and attesting for meaningful use. We have secure document storage and incentive program audit preparation. Some of these tools and resources that I'm speaking of are resources that are housed within our, what we call the MIHI member portal. This is a self-directed online tool which has a host of tools available to assist providers with the various programs, particularly meaningful use, and providing tools, like we mentioned earlier, the security risk analysis is a very critical piece of meaningful use. We have, as part of our privacy and security tools, Secure Connect, a tool that can help you conduct your security risk analysis, help you evaluate and assess where you are with privacy and security, help you develop remediation plans, and again, help you successfully meet the measures for that objective towards meaningful use. Supporting providers with patient engagement resources. Again, these are another resource or tool within the MIHI member portal where we have another assessment-based tool where you can assess and see where you are with how you're engaging your patients, and then even help you with ways to improve your engagement. We mentioned the security risk analysis. Again, provider workshops that we put on periodically. Most recently, a month or so ago, we held a workshop specifically around security risk analyses and sort of demonstrating our tool. And there were providers who actually enrolled or signed up for the workshop and were able to even work towards completing their actual security risk analysis. And then there are other host of health IT resources that we provide as well. One of which the fact that we have people within MIHI who we work with, practices across the Commonwealth. So among the tangible tools and the member portal, we also can bring our experiences and best practices from our work with other providers and bring that to you as well. Providing eHealth education, educational outreach. Again, this is an example here for informational webinars. This is targeted specifically for dental providers. We have other programs that are currently targeting behavioral health. So seeing where we can sort of provide the best assistance for those who may feel like these programs again are not specifically set up for them. And then again, subject matter expertise, as I mentioned, on topics of interest to provider organizations. We are in tune with all the different regulatory organizations. Again, we work with all types of practices across the Commonwealth and can bring that subject matter expertise to providers such as yourselves. This graphic here just sort of outlines some of the tools and resources available within the MIHI member portal that I mentioned. One aspect that I didn't mention was the resource library. Throughout the member portal, as you navigate, you'll see numerous links that provide educational information or on various topics, or may take you directly to another website to give you information on a specific topic. So those educational resources are abundant throughout the member portal. Implementation guidance around EHR adoption. Looking at a couple of these, we mentioned privacy and security. There are live and on-demand webinars. Some of this information as well, if you go to our MIHI website, you'll get additional detail on some of these tools and some of the resources that we have available. The meaningful use progress tools you can see there on the bottom left. Again, the meaningful use gap analysis is just one piece of service that we provide for providers that are working through stage 1, stage 2 meaningful use. Audit support as well. With secure document storage, as you can see, is another piece here as well in terms of helping you with maintaining all of your supporting documentation and backup information around meaningful use. In particular, something like with privacy and security in your security risk analysis, having your assessment and any supporting documentation saved within our security document storage. A third party, such as MIHI, who is in contract with MassHealth and who is working with providers across the state. This would be very important for if an audit were to happen, that you have this third party sort of securely storing your documentation, your backup information, and having the right backup information to make sure that you can pass those any audits that may come. We mentioned patient engagement as well, and then there's live chat where you can actually get live help from a service member here around various subjects that you'll find, or any obstacles you may come across with meaningful use of the different programs, and particularly within using the member portal. So another key tool within our member portal. Okay, so takeaways. Oops, no, too far. Takeaways here that we want to make sure that that you understand. Health IT landscape is growing more complex as the day goes on, as the years go on. As you can see, there are some changes taking place, or will be taking place around the objectives and measures for meaningful use. So don't let that be something that's an obstacle. You have a resource here with MIHI as your health IT resource to help you sort of navigate that landscape. Meaningful use has become a widely adopted national standard. I think you mentioned before how across the Commonwealth here, all the hospitals are in the game and are demonstrating meaningful use of certified EHR technology. And as separate practices and providers, you want to adopt this as well. You want to be one of those providers that may receive referrals from these hospitals and being able to exchange information with other providers throughout the Commonwealth. We mentioned that CMS has proposed significant modifications. Liz sort of walked through those and what those are about of 2015. Again, we talked about the special considerations for dentists who wish to achieve meaningful use. Again, it's looking at each of the objectives on their own. It may not apply specifically to your practice, but meaningful use does apply to you. You can participate in the programs, you can achieve meaningful use, and importantly, you can receive those incentive payments for doing so. And then meaningful use, for MIHI can assist dental providers again in achieving stage 1 meaningful use. That's why we wanted to provide you this webinar here to let you know that you have a resource available to you. We can help you do this for stage 1, as well as just even just get a better understanding with navigating the landscape of health IT. Okay. With that, I think, Liz, we're going to take any questions that might be out there.
Sure. So it doesn't look like we've received any questions during the webinar session, but I'd like to take this opportunity to invite the audience to go ahead and submit any questions, and Thomas and I would be happy to try to provide an answer. In the meantime, I'll go ahead and advance the slide to our contact information so that you'll have this available if you should need to contact us in the future. You can always reach us at our 1-855-MASS-EHR telephone number or our general email, which is ehealth@masstech.org. And then specifically, Thomas's contact information is listed here, his email and his direct extension. If you'd like to speak with him more about MIHI's eHealth services or our services that we can provide to dental providers, specifically around stage 1 meaningful use, I'm sure he'd be happy to talk to you. It doesn't look like we've received any questions. So at this time, we'll go ahead and close out the webinar, but I do want to thank everyone for your attendance and your attention today. And again, encourage you to please contact us if we can be of any assistance with any health IT needs or questions, or specifically around stage 1 meaningful use. We're certainly here to support everyone in the health community with the Meaningful Use and other health IT initiatives. Thanks again for your attendance. Take care.